My name is Valentina Restrepo. I am a doctor. I graduated from medical school in Colombia, and I am currently working as a classic hematology postdoc at Yale School of Medicine. So as part of my job here, we wanted to do a characterization of the coagulation parameters of patients who have venous malformations. So as we know, patients with venous malformations can develop coagulopathy as a complication of their disease. So this is usually referred to as localized intravascular coagulopathy. Because the derangements in the coagulation cascade, they begin in a local manner inside the lesions of the venous malformations. So we wanted to do like a comprehensive characterization of it because currently, like, there is not much literature about this topic. There have only been like a few studies to characterize what coagulation parameters are altered in these patients. And so far, these patients are screened using D-dimer because the available literature shows that D-dimer is the most commonly affected coagulation parameter in them. So we wanted to like see further to see if like other possible coagulation parameters were also altered. And so, yeah, basically we wanted to like have a better picture of how coagulation parameters look in these patients. So actually we found that so like the first, most like the first finding we always like to discuss is that the most commonly altered coagulation parameter was not the dimer, as it is described in like current literature. It was actually thrombin antithrombin complex. So it was altered in more than 60% of patients, while the dimer was altered in around 52%, 50-something percent of patients. So yeah, so that's like the first important finding, that the most commonly altered coagulation parameter is not the dimer, it's thrombin antithrombin complex. So apart from that, we also found that we performed a correlation matrix to see how all these coagulation parameters behaved in relation to one another. And we found that the correlation between thrombin antithrombin complex and the dimer was very, very low. It was very, very weak. And so that, that's noteworthy because when you think about these two parameters, they should behave in a way that they should strongly correlate to one another. But we found that the correlation was very weak. Apart from that, we also found that among patients who had a negative D-dimer, who would have like a negative LIC screening per the standards that we use nowadays, these patients still had derangements in other coagulation parameters. So half of them had a high thrombin antithrombin complex. That's very important. And up to a third had derangements in other coagulation parameters like von Willebrand factor, antigen, and stuff like that. So it is very important. Another important finding is that we found that like so we focused, our analysis of we further broke down our analysis looking for how thrombin antithrombin complex and the dimer, which were the two most commonly altered coagulation parameters, we wanted to see how they behaved according to like characteristics of the venous malformation. So we saw how they behaved according to lesion size, to the depth of tissue involvement, to the location, if it's in the head and neck or limbs or trunk. And we found based on this that patients who had smaller lesions that we defined as lesions that have a surface area less than 10 millimeters square. So we found that patients who had a smaller lesion size, they tended to have a negative D-dimer, but a high thrombin antithrombin complex, while patients who had a larger lesion size greater than 10 millimeters square tended to have a high D-dimer with a high thrombin antithrombin complex. Like overall, it was very, very rare to see that a patient with a positive D-dimer had a negative thrombin antithrombin complex. It was very, very rare. So we saw in patients with smaller lesions, they tended to have a negative D-dimer, but what gave away the LIC was a high thrombin antithrombin complex. Patients with larger lesions, then they will have high both parameters. So, like a hypothesis that could be generated from that is like we could evaluate specifically the importance of thrombin antithrombin complex to screen for LIC in patients who have smaller lesions, because they tend to have like more negative, like they tend to have a higher frequency of a negative D-dimer, but thrombin antithrombin complex is still elevated. So, like for the future of this type of research, so there are like a couple of things. So first, it will be very good to see if there are other, perfecting the way in which we measure the size and volume of these venous malformations, because they have like very, very regular shapes. So the burden of disease is hard to assess. So, like increasing the accuracy of the measurement, not by using surface area, but by using volume, which is like a more accurate way of assessing the burden of disease, to see if it's still if it still has a relationship with the resulting D-dimer and thrombin antithrombin complex. Because if it does, then we could, potentially find a population in which screening for LIC with thrombin antithrombin complex is like specifically useful. And apart from that, this is all based off, this is an observational study. So it's like, we cannot really emit recommendations in management from it. So like in the future, it will be like necessary to actually conduct like a different type of study in order to be able to, finally say like, okay, this is the correct way of assessing for LIC, and, assessing it in X or Y way has, a certain effect in patient outcomes or something like that.